What's become increasingly clear to us over the past 5 or 6 years, actually, is that every patient and every medical encounter occurs in the context of the broader community and society, and that what is good for an individual patient may in fact be robbing a society or a community of values or resources that need to be brought into the conversation with the patient. Now, that's a very difficult thing to do, and we're just beginning to learn how to do that and how to even think about that element of medical professionalism.
Physicians in practice every day are confronted with choices to make about how to use resources. If a 25-year-old person has chest pain and they don't have any risk factors for heart disease, we know that person with a normal physical exam and an unusual history for anything that sounds like heart disease, that person isn't going to turn out to have coronary artery disease. And sending that person for a stress test and sending that person for a high-resolution CT scan to look for a calcium score, I think that is something that physicians can and should resist. When new drugs get introduced, I've seen data when you look at areas for an entire population, they get utilized very heavily. And yet, they're not reliably better than the old drugs. They may just be more expensive.
Where I think this plays out most poignantly for the individual physician is dealing with the patient at the end of life. We have so much ability to intervene. We could run so many tests, to do so many things to patients. But would it be fair to the patient in terms of the suffering they would incur? Perhaps prolonging that suffering. And is it fair to society to consume all those precious resources when really the patient needs to be given safe passage through the end of their life? I think this is where we really confront it with the greatest difficulty as physicians.
It's easy to feel, oh, what difference does it make if I give them an antibiotic this time? Oh, what difference does it make if I order the MRI because they ask for it? They want it. I know it isn't going to do any good. The patient will be happier if I just say yes. Why not just say yes? And I think the problem with that is kind of very parallel to what goes on in conversations in the environmental movement about sustainability and global warming. Can I really stop global warming by buying a higher efficiency car or a higher efficiency appliance? Can I really stop global warming by walking when I could have driven? Certainly I can't, individually. On the other hand, if no individuals make those choices, we're all in big trouble.
When I try to think about why would such good people, the doctors I know, have been led to neglect this larger view of social obligations in terms of medical professionalism, I actually think it has something to do with our overall American culture and our psyche. We are a very individualistic nation. We tend to place a lot of emphasis on personal responsibility, personal achievement, and sometimes we don't think about the larger public good as readily as perhaps some other nations do. Our healthcare system crisis, I think, is finally calling us to look at those larger social issues, and it's calling us in medicine to really assess how much do we believe these larger questions of social fairness are the responsibility of each and every one of us as an individual doctor.